gonna be my last one.
Are you going to be currently licensed to practice medicine in the state of New York? Yes, I am. Are you licensed to practice medicine at the present time in any other states, doctor? No, sir. Have you taken any medical specialty boards? No. Do you currently have an area of medicine that you specialize in, by the way? No, general surgery. Just general surgery? Yes. Can you explain what the area of general surgery consists of? It includes the treatment of diseases of the soft tissues. Do you currently have privileges at any hospital? Yes, I do. And what are hospital privileges, doctor? They are to hospitalize patients, take care of them within the confines of the hospital. And what hospitals do you currently have privileges in? At St. Catherine's Hospital in Smithtown, for one. Defense counsel, I am willing to concede his expertise, Your Honor. Plaintiff's counsel, I decline the concession. The court, proceed. Have your privileges to work at any hospital ever been suspended or revoked? No. Are you currently a member of any medical societies? I am a member of the American Board of Surgery, as well as a member of the New York Medical Society. Are you affiliated with any medical school? No, I am not. Do you currently maintain a private office for the practice of medicine? Yes, I do. And your office address is what, please? 322 East Main Street, Smithtown. Approximately how many patients do you treat in an average week currently? This is inpatient and outpatient or what? Yes. Well, I don't know. I would guess. Okay, and how many times on average do you perform surgery during a typical week in the operating room at the hospital? Oh, I guess on average 10 to 12. Defense counsel, Your Honor, I move to have Dr. Robinson qualified as an expert in the field of general surgery. The court, it's not necessary in the second department to do that, counsel. Plaintiff's counsel, okay, Your Honor. The court, what is it, counselor? Defense counsel, the doctor speaks low and there's people outside. I don't know how to correct it. The court will correct it. Plaintiff's counsel, shall I withdraw and start that question again, Your Honor? The court, go ahead. Plaintiff's counsel, thank you. Doctor, have you ever testified as a witness before in a medical malpractice case? As a witness. As a witness? No. Doctor, are you being compensated by my office today for the time you are spending in court? Yes, I am. Does your compensation depend in any way upon the outcome of this case? No. Doctor, do you recall when you first met Thomas Pepper? I have a recollection. Okay, and approximately when was that? Well, it was in the year of 2000. Doctor, if I were to show you, I don't recall exactly when, actually. What's been marked into evidence as Plaintiff's Exhibit 3? Would you be able to tell them or tell from looking at the chart? Yes, I could. Plaintiff's counsel, Your Honor, may I give the witness this paper? The court, certainly, counsel. This is not a direct recollection, but going by the court. No, that's not a direct recollection. Remove that from his presence, please. If you have no recollection, you have no recollection. If that doesn't refresh your recollection, we'll move on to the next question. Doctor, do you have a general recollection of Tom Pepper's general physical condition when you first saw him? Yes, I do. Can you describe for the ladies and gentlemen of the jury your general recollection of Tom Pepper's physical appearance when you first saw him? Well, he was quite ill. He was clearly weak. Did he have distended abdomen? Yes. Doctor, what is a distended abdomen? An abdomen that is protuberant, larger than it normally is, blown up. Okay, and when you say he was quite ill, what does that mean? Well, he had the appearance of somebody chronically ill by virtue of his malnourishment. Would you say he was malnourished, more acutely ill in that he was septic? Yes, he had a temperature and he looked like somebody who was more than just chronically ill. There was clearly something going on that was making him very sick at that time. Defendant's counsel, objection, speculative. The court, sustained. Do you recall if any members of Tom Pepper's family were present when you first saw him? No. Did you obtain a medical history from Tom or any member of the family before you rendered any treatment to him? Defendant's counsel, irrelevant. The court, overruled. Yes, I did. Who did you get that history from? I believe both from the patient and his wife. Okay, and do you recall what that history consisted of? The details I don't recall. I know that he had what's called a low anterior resection for a cancer of the rectum. There had been some post-operative problems. He had been discharged and shortly thereafter re-hospitalized, now at St. Catherine's, and he had been in the hospital for, I don't know, maybe 2 or 3 days. I don't recall exactly, but he had been in the hospital, admitted by his primary care physician, and then I was asked to see him. Doctor, why, as a physician, do you take a medical history from a patient? Defendant's counsel, I object, Your Honor. Operation of the mind. The court overruled. Well, it's really the most important aspect of trying to define what's going on and what needs to be done. And did you perform a physical examination on Tom Pepper the first time you saw him? I sure did. Okay, and why would you perform a physical examination? He's trying to define what's going on and what needs to be done. As a stepwise procedure, the first thing is to get a full history, and the next step is to do a physical examination to define what the illness is and where the location of it is, and further data as to how ill the person is. Did you order that any tests be performed after your physical examination was completed? I do not specifically recall whether I was the one ordering the CAT scans or not. I may well have been. Okay, now, what is a CAT scan? Okay. It's pretty good. 190.